Dr. Sanjay Prasad, welcome to the Human Capital Innovations Podcast.
Thank you, John. A pleasure to be on your show. Thank you.
Yeah, I'm super excited to have the conversation with you today. And you bring years of experience in the medical field to the conversation, as today we're going to be focusing on how kind of the intersection of management and dealing with employees regarding healthcare efficiencies and employee wellness and healthcare issues within the workplace. As we get started, I wanted to share Sanjay's bio with everybody. With nearly 30 years of practice in the super specialized field of oncology, neurotology, and school-based surgery, subspecialty within, I can't even say that word, I can't say that word.
Otolaryngology, yeah.
It's a specialty when it's a nice, big, long medical word. With a subspecialty within the head and neck surgery area, Dr. Sanjay Prasad is one of the few surgeons in his specialty to complete 3 fellowships in neurotology. As a medical director for an ambulatory surgery center, he was one of the first to start bundling surgical services for all-inclusive prices in 2014. In the same year, Prasad found Surgiprice Inc. with subsidiaries Surgicality and Surgiconnect. His 30 years of surgeon and managing the care of tens of thousands has given him deep insight into the flaws in the surgery referral process. Dr. Prasad reveals that between 10 to 20% of all surgeries in the US are unnecessary, either because of misdiagnosis or because a more conservative therapy may have been just as or even more effective. In his new book, Resetting Healthcare, Dr. Prasad examines the lack of transparency in surgical care and offers a solution to the problem, a new innovative tool called Surgicality that connects patients with qualified surgeons, offering second and third options, and even suggesting more conservative non-surgical solutions as appropriate. What a wonderful background. It's a pleasure to have you. Anything else you would like to share with listeners by way of your background before we really launch on in?
Yeah, and my mom reminded me of some of our family history. I was born in India, and I came here when I was a year old, and our family of 4 came in 1962. So now you know my age, and we came by ship. Month-long journey through the Suez Canal. And we had a healthcare problem in the family. We were searching for a healthcare solution, searching for the right surgeon. Isn't that amazing that 1962, we were doing that? I grew up in the Washington, D.C. area, became a surgeon, practiced for 30 years. And now I built a company, Surgicality, that really is helping patients connect to the best-in-class surgeon within their network, whether it's Blue Cross or Cigna or Aetna, United Healthcare, Medicare, Medicaid. We're all about connecting them, because what's really tainted right now, what's really not working, is that referral process. And I was talking to a consulting group yesterday, and they put it so well. What we're doing is referral pattern optimization. So we're taking that referral that you normally get from a primary care physician to a surgeon, and we're taking it to the next level using the latest technologies and the latest know-how in terms of data management. And because what's happening today is that referral is being made on the basis of habit. And it's being made on the basis of a referral nurse, for example, has a list of orthopedic surgeons. She has their favorite orthopedic surgeon upstairs. They just refer everyone there. But you have a whole provider book of surgeons. What's happening is patients are getting surgery they don't need. Patients are getting complications from surgeries they don't need. Patients are getting connected to surgeons, not necessarily getting the best outcomes. Patients are suffering from complications, infections, wrong size implant, need for revision surgery. It's a ever-ending cycle. And as you mentioned, depending on specialty, 15 to 30% of surgeries are unnecessary. So we've got to do something to turn the tables to help the healthcare system kind of compete to take care of you, if that makes sense.
Yeah, yeah, it absolutely does. And that's been one of my frustrations, with the healthcare industry and insurance companies generally. Clearly it's a big, complex, messy problem that I don't pretend to have any answers for. But just the transparency issue or lack thereof is frustrating, and it's hard to navigate. And of course, we know that healthcare costs have just continued to go up. I mean, last I looked, it was, like something like 30+% a year, kind of over the last couple decades of increased costs. And so then the question is, well, why? Why is all that happening? Because obviously that's hard for individuals and for families. It's also hard for organizations who are trying to provide health benefits for their employees, and employers are getting squeezed because they either have to have their employees pay more and more into the health benefits that they provide, or they have to try to keep the same level, which means they're kind of reducing the coverage and the care that their employees can get under the organization provided healthcare insurance. And so that's just a huge problem. And what you're describing seems like a piece of the puzzle, at least in terms of trying to be more efficient, more cost effective, to drive more transparency within the system. I myself was once referred. Well, actually, it's happened twice. Actually, I was twice referred for surgeries that it turns out I didn't need, and luckily I was able. So I actually, in both cases, scheduled the surgeries, and in both cases showed up, and in the conversation with the surgeon, it was actually determined, no, you don't need this, which was a good thing, right? But how often does that happen? It's probably much more common for you to get scheduled and you go in, and it's just, you go through the pre-op and all the stuff, and then you go in, you have the surgery, and then you're done. And if it was unnecessary, all the other types of issues and complications like you described can come about, which obviously is not good for anybody if we're trying to meet the healthcare needs of our people within an organization, through the health benefits, and when we think of society as a whole and how we're treating people in our communities.
Yeah, and well said. And I didn't elaborate on the solution, the Surgicality solution, which is really it's twofold. It's a concierge platform. You're told you need surgery, John, just like you were told. You had some diagnostic imaging, you have some medical records, and a concierge has you sign a HIPAA release, and then all the magic happens on the back end. And the magic is, sourcing your medical records, sourcing your imaging, sending it up to the HIPAA compliant cloud, safe, secure manner, and then sending it to multiple surgeons through our SurgiConnect system, SurgiConnect app. And these surgeons have to be board certified. They indicate an area of interest in the condition that you have. They review your records, they validate necessity, they offer alternative treatment options, and more importantly, they put in their past experience. That is, doctor, how many of those meningiomas did you do last year of that type? What was your success rate? What was your complication rate? And then we also corroborate that with their medical record, and we compare the cohort of surgeons. So then you as a patient get back a list of surgeons that have seen your case, that have opined on your case, offered treatment options, and also put out their past experience information. And you are empowered to make important choices, and we're empowering you with tools to compare surgeons using procedure-specific quality measures, so you make well-informed decisions. It just makes a ton of sense, right?
Yeah, I mean, in so many areas of our lives, and in the marketplace, that's exactly what we have the ability to do. You have more transparency, you have metrics, you can go in and evaluate what the best options might be and who to do the service with or whatever. It only makes sense that we'd be able to do this more in the medical field as well. And I'm curious what you're seeing in terms of how this is impacting organizations, businesses trying to provide, cost-effective, efficient healthcare benefits to their employees.
Yeah, I mean, it's obviously affecting their workforce in a massive way. Well, I mean, when key employees, doesn't have to be a key employee, when any employee, has to take time off and have unnecessary surgery, have complications, there's a workforce shortage. It creates lots of havoc, depending upon the organization structure of the system. But and I will highlight that one of the major problems, and I realized this about a year ago, is that there is a tremendous racial disparity between Black and white patients, in that Black patients suffer from poorer surgical outcomes compared to white patients. And even when you control for extent of disease, comorbidities, and socioeconomic status, these disparities persist. So it's jaw-dropping to me. A very nice meta-analysis was published in 2012, 88 articles, ton of information. Really, nothing was being done. But our platform, when we send the cases out to the surgeons, we de-identify for race, name, and ethnicity, and it just makes a ton of sense trying to eliminate the bias. But I would tell you that it may not just be implicit bias. The healthcare system may actually trap Black patients, Hispanic patients within a certain network, a sub-network of their Blue Cross plan, for example. And what do I mean by that? Well, Spanish-speaking patients may end up with Spanish-speaking primary care docs, Spanish-speaking surgeons. They may not be the best heart valve surgeon in the entire network, so they end up having surgery. So what we're doing is we're opening the network. We're leveling the playing field for Black Americans when they need surgical care. It just makes so much sense. This is the message that is permeating and resonating with the Fortune 100, Fortune 500 companies. They all want to fix this problem. They're eager to fix the problem. And it's been such an exciting ride.
Well, yeah, that pointing out the health disparities in these populations, I think, is a really important point. And so if we want more equity in our healthcare system and we want better outcomes for everyone, that's certainly an important consideration for sure. I'm also curious, what about the costs involved with providing a meaningful quality healthcare benefit to your employees? What can we do about that to get expense and cost under control?
Yeah, remember, even if you're fully insured or self-insured for your health plan as an employer, your premium rise year over year is based on your claims cost. So even though you're fully insured, you are at risk, because if your claims cost is very high, your employees are using the healthcare a lot, spending a lot of dollars, it's going to show in your premium adjustment for the following year. That's the way the system works. So you have to pay attention, even though you are fully insured, with what's happening with your claims. So what I'm getting at is getting patients, away from unnecessary surgery. We look at the metrics with the platform. There's a savings of about $1,000 per employee per year. So if you have 500 employees, you're saving $500,000.
That's huge.
I mean,
yeah.
That's a big savings, huge savings. So one is to eliminate unnecessary surgery, tremendous savings. Two, connect to the best surgeon, get that aortic valve done with the high volume, high quality doc. Get it done right away, faster recovery, back to work. It just makes a ton of sense all around.
Yeah, I mean, it really does. And I can't imagine any organizational leader out there sitting around listening to this thinking, oh, I don't want to save $1,000 per employee in terms of the premiums every year. I mean, just think of how that translates into bottom line benefits to the organization, but also to the employees, because again, it's not just employers bearing the cost of rising healthcare costs, and insurance premiums and such, but employees are having to pay more and more into their healthcare coverage every year. And so, this is going to benefit both employees and their families, as well as the organization. And the other piece of this, beyond the bottom line, like dollars and cents cost efficiencies and whatnot, the other side of this is you just have more healthy people who are getting the care they need when they need it, in a way that's going to actually benefit them, as opposed to having people suffer through needless surgeries, or less effective and impactful surgeries, and just then there's all of the time away from work that both the employee and the employer have to deal with. There's just so many connected pieces here that it just makes so much sense for us to try to tap into the types of resources that you're providing. I really appreciate all these insights. Before we wrap up, I'm wondering if there's any kind of final thoughts on what anyone listening today should be doing now as they're trying to start down this process of figuring out what makes sense for them and their organization and the healthcare coverage.
Well, individually for patients, they need to, you're told you need surgery. You really just need to hit the pause button, right? And don't jump just right from the exam room to the scheduler's office and get a date together and start that planning phase. You got to pause. I mean, you need to ask the surgeon some difficult questions. Doctor, do I really need it? What would happen if I don't have it? What are treatment options? Doctor, how many have you done? What's your success rate? What's your complication rate? Anybody ever died? These are all questions they need to ask, and they need to be able to have the ability to understand the answers and to compare. And that's where they need a concierge, they need a helping hand to help them through the process. So pausing is extremely important. Now, for institutions, for employers, look, they're saddled with high costs year over year over year. They've got to get a handle on their claims costs. This just makes a ton of sense. It elevates the care of their Black employees and Hispanic employees and Latinos and Latinas. I mean, it just makes a ton of sense to use the platform.
Yeah, well said. Oh, go ahead.
No, I wrote a book, Resetting Healthcare Post-Pandemic, Post-COVID-19 Pandemic. And I wrote it, and the title is really apropos because we had a pause in surgery scheduling last year. There's an explosion of surgeries that's happening this year and beyond. It's a great time to reset healthcare as we know it today. The book is written for the layperson. You can find it on Amazon. You can find it on Barnes & Noble. If you want to know more information about the book, you go to resettinghealthcare.com. And if you want to know more about the service, the Surgicality service, you can go to surgicality.com. I'm happy to entertain questions at any time. You can send me an email at info@surgicality.com, and I promise I'll respond as quickly as I'm able.
Perfect, Sanjay. It has just been a pleasure. I really appreciate all the insights. I appreciate the good work you're doing in trying to solve this problem. That is a really important thing, and the impacts are going to be huge. I encourage listeners to reach out, to get connected, find out more about what Sanjay and his team can do for you. Check out the service, check out his book, and study up a little bit more on the challenges facing our healthcare system and what some possible solutions might be. And as we're kind of in that process of, or at least have the opportunity, the potential of doing a bit of a reset and making this system work for us better. Reach out, get connected with Sanjay. And as always, I hope everyone can stay healthy and safe. I hope you can find meaning and purpose at work each and every day. And I hope you have a great week.